My dear friends, I am Dr. Omkar Prasad Vaidya. Today I will be discussing about the risk factors of hepatocellular carcinoma. Now, hepatocellular carcinoma simply means liver cancer or malignant changes in the liver tissue or hepatocyte. Now, there are many risk factors which is responsible for causing hepatocellular carcinoma like cirrhosis of liver and very many viral infection like hepatitis B, C, and various chronic liver disease also or inherited disorders of metabolism also may leads to hepatocellular carcinoma. Beside exposure to various toxins also leads to hepatocellular carcinoma. Now, the depending on the degree of involvement of the hepatocellular carcinoma, the sign symptoms of hepatocellular carcinoma will be manifested. Mostly, uh, hepatocellular carcinoma is present in those patients who are already suffering from chronic liver disease. So they may be already suffering from any, or they may be having already some pre-existing sign symptoms of chronic liver disease, because most of the patients who are having chronic liver disease may ultimately transform into cancer patients. That is, the chronic liver disease may convert it into hepatocellular carcinoma if the chronic liver disease is not prevented with necessary intervention in right moment or with right way. So, knowledge of the proper risk factors are very much important so as to prevent the development of hepatocellular carcinoma from the various types of chronic liver disease. And if we know the risk factors of development of hepatocellular carcinoma, then it can be prevented, and we total damage to the liver can be prevented. Otherwise, hepatocellular carcinoma can be going to a stage where it needs total resection of the liver or total removal of the liver, or it needs a liver transplantation. So to prevent so much complication, if you know the various risk factors, then we can prevent the progression of the various chronic liver disease or other conditions into hepatocellular carcinoma, and thus we can take some preventive measures to protect against hepatocellular carcinoma. So that's why today we are going to focus on various risk factors of hepatocellular carcinoma. So number one risk factors of hepatocellular carcinoma is chronic alcoholism. Chronic alcoholism is not only risk factor for various cancers, it also increases the risk of heart disease, stroke, hypertension, heart failure, and many other risk factors or various critical conditions. It also increases the risk of many cancers like uh, breast cancer, and it is also exposed to various type of cancers, increase the body prone to various cancers, and it has been found to be associated with colorectal carcinoma also. When it comes to hepatocellular cancer, alcoholism also one of the important risk factor, because chronic alcoholism is responsible for fast starting of the chronic liver disease, that is alcoholic hepatitis, which ultimately converted into fatty liver, which may converted into steatohepatitis, and which ultimately lead to cirrhosis of liver. Now, if the person does not stop cirrhosis and further exposed to alcohol, it may convert into a stage of hepatocellular carcinoma. So, alcohol is a risk factor for chronic liver disease, alcoholic liver disease, alcoholic hepatitis, then fatty liver, as well as cirrhosis of liver. Now, cirrhosis of liver, if it is not prevented in right way, it may lead to conversion into hepatocellular carcinoma. So, chronic alcoholism may be one of the important risk factor for colorectal carcinoma. Next comes the various viral infection like hepatitis B and C. Now, according to recent literature, that hepatitis B and C, these are the most important or most common risk factor that may lead to development of hepatocellular carcinoma. So, hepatitis B especially contributes to 50% of the development of hepatocellular carcinoma. So, we should not take hepatitis B virus infection so lightly. We should treat it immediately, and we try to cure the disease. There is vaccination also against hepatitis B. So, those who are taking regular blood transfusion, or those who are social workers or health workers who are exposed to blood products, and we have to avoid needle prick injury also and unprotected sex also, because hepatitis B can spread by blood transmission, and it may be bloodborne, and it may transmit it through blood products. So we have to be very much cautious so as to prevent the hepatitis B infection, because once infected, the virus may remain in the blood for longer time, and it may person become a chronic lifelong carrier, and this such type of person or patients who become a lifelong carrier of hepatitis B may ultimately develop into hepatocellular carcinoma. So we should try to prevent the hepatitis B by proper vaccination, avoiding unprotected sex and sharing of needles, and avoiding exposure to blood products. And if the patient is found to be hepatitis B positive, they should be take treatment regularly so as to prevent the progression of the disease or damage to the liver. Hepatitis B virus also leads to cirrhosis of liver, which can ultimately convert it into hepatocellular carcinoma. Another important viral infection is hepatitis C. This is also a blood-borne infection which can be transmitted via blood. Sharing of needles, unprotected sex can be mode of transmission in case of hepatitis C also. Most of the hepatitis B and C patients are associated with HIV. It has been found that even HIV positive patients who may be associated with hepatitis B and C cases or infection, and they are ultimately associated with hepatocellular carcinoma in future. Thus, we should take hepatitis B and C viral infection very seriously, because both these infections may be one of the important risk factors for development of hepatocellular carcinoma. Next comes the non-alcoholic fatty liver. Now, alcohol is responsible for causing alcoholic fatty liver, but non-alcoholic fatty liver can also lead to hepatocellular carcinoma. Now, obesity, hypertension, metabolic syndrome, diabetes, hypercholesterolemia, these are the various causes of non-alcoholic fatty liver. And non-alcoholic fatty liver leads to cirrhosis, and cirrhosis ultimately leads to hepatocellular carcinoma by gradual transformation, or if you don't prevent the risk factors to acting on the liver. Thus, non-alcoholic fatty liver can be one of the important risk factor for development of hepatocellular carcinoma. Then there is some hereditary disease like hereditary hemochromatosis. What is that? That is an inherited disorder where there is a defect in iron metabolism and there is excessive iron absorption, and also there is a defect in iron transfer. That's why iron will deposit in various parts of the body. In the liver it may be deposit in heavy dose or in excessive amount, leading to damage to the structure of the hepatocyte and ultimately leading to hepatocellular carcinoma. Hemochromatosis also leads to cirrhosis, and cirrhosis may ultimately advance to a stage of hepatocellular carcinoma. So hereditary hemochromatosis can be one of the important risk factors for development of hepatocellular carcinoma. Then we have an alpha-1 antitrypsin deficiency. Now, alpha-1 antitrypsin deficiency may also lead to emphysema, lung problem, COPD, and which may be associated with cirrhosis of liver and hepatocellular carcinoma. So, in alpha-1 antitrypsin deficiency, there is a defect in the alveolar surface wall, and they become dilated, leading to emphysema. And also in these patients who are having the alpha-1 antitrypsin deficiency, they may also suffer from hepatocellular carcinoma and cirrhosis of liver. There is another important risk factor for development of hepatocellular carcinoma is primary biliary cirrhosis. Now, in primary biliary cirrhosis, because of autoimmune or because of inflammation, there is a damage to the bile duct and biliary tree, and because of that, the movement of the bile cannot occur, or bile flow is affected. There is more accumulation of bile inside the liver, and that's why there is congestion of the liver. And because of this, or accumulation of the bile in the liver, it leads to biliary cirrhosis, and it may also increase the risk of liver cirrhosis, which may ultimately leads to hepatocellular carcinoma in the long run. So primary biliary cirrhosis should be treated with sincerely, as it may be one of the important risk factor for development of hepatocellular carcinoma. Then there is another important risk factor known as autoimmune hepatitis. Autoimmune hepatitis means here antibody is produced against the hepatocyte or liver cell, and leading to destruction of the hepatocytes, which may lead to cirrhosis as well as hepatocellular carcinoma. Then there is diabetes mellitus. Diabetes mellitus, especially type 2 diabetes mellitus, and those patients who are having uncontrolled diabetes mellitus, they have higher risk of suffering from cirrhosis of liver, because type 2 diabetes mellitus is associated with obesity, hyperlipidemia, abnormal lipid profile, dyslipidemia, high cholesterol level, and thereon the cholesterol may deposit in the liver and fats may deposit in the liver, leading to fatty liver, especially non-alcoholic fatty liver, which ultimately proceed to cirrhosis of liver, which over time may lead to hepatocellular carcinoma. Thus, type 2 diabetes mellitus should be very much controlled by proper anti-diabetic therapy or dietary restriction or calorigenic control, so that it does not lead to development of hepatocellular carcinoma in the long run. Besides, exposure to pesticide has been found to be very much toxic to liver and ultimately can lead to hepatocellular carcinoma. There is a important toxin produced by fungus known as Aspergillus, group of fungus known as Aspergillus flavus, and we call it aflatoxin B1. This aflatoxin B1 is one of the important fungal toxin that can damage the liver and leads to hepatocellular carcinoma. So there are two important toxins, one is alcohol, another one is aflatoxin B1. These two toxins can cause direct damage to the liver and leads to hepatocellular carcinoma. So we should be very much cautious of those food products which are infected or which are contaminated with aflatoxins. So aflatoxin B1 toxins may present in peanuts, it may present in some vegetables, it may present in rice, grains, whole grains, and storage products. So we should always go to see the aflatoxin levels in various storage foods, so that we can prevent the risk of development of hepatocellular carcinoma in future. Besides, schistosomiasis or is an infection because of Schistosoma mansoni, and this parasitic infection can ultimately also leads to hepatocellular carcinoma. So Schistosoma mansoni infection or schistosomiasis should be very strictly controlled or treated by several drugs so as to prevent the risk of hepatocellular carcinoma in future. Besides, it has been found that not only hepatitis B and hepatitis C individual infection, but they are together co-infection. That is, when both hepatitis B and C virus are present, both of them, if they are together present in a particular patient, then they may increase the risk of hepatocellular carcinoma to a high degree. So co-infection of both hepatitis B and C increase the risk of hepatocellular carcinoma very much. Besides, according to some study, hepatocellular carcinoma can have gender as one of the important risk factor. Hepatocellular carcinoma is very much common in male because alcoholism is very much common among male. Besides, various liver problems are also common among males. But fibrolaminar type of hepatocellular carcinoma is common in women. So that is another important exception. Otherwise, most of the hepatocellular carcinoma is very much common among male. Besides, another important risk factor is cirrhosis. Now, almost all the risk factors that cause hepatocellular carcinoma also cause cirrhosis. Now, once cirrhosis is produced, and if the factor responsible for causing cirrhosis or further damage to the liver is not prevented, then it may lead to hepatocellular carcinoma. So cirrhosis may be an important risk factor for development of hepatocellular carcinoma in future. So we should try to prevent progression of cirrhosis of liver and to prevent involvement of the healthy hepatocytes. Heavy alcohol use may be one of the important risk factors that I've already explained. Then non-alcoholic liver disease also another important risk factor we have already discussed. Then type 2 diabetes mellitus is also another important risk factor because it not only responsible for hypercholesterolemia, hyperlipidemia, but also leads to obesity and various cardiovascular disease also. And it has been found that type 2 diabetes mellitus may be associated with fatty liver, it may be associated with hypercholesterolemia, non-alcoholic fatty liver, and it may lead to cirrhosis also, and if cirrhosis is not controlled may lead to hepatocellular carcinoma. Besides, certain rare conditions like tyrosinemia, alpha-1 antitrypsin deficiency, porphyria cutanea tarda, glycogen storage disease, Wilson disease can also be responsible for development of hepatocellular carcinoma. So what is Wilson disease? It's a defect in copper metabolism because of abnormal or defective production of ceruloplasmin. So ceruloplasmin level is very much less. That's why copper cannot, there is a defect in transfer of the copper. Copper will deposit in the liver and ultimately leads to toxic effect on the hepatocyte, leading to cirrhosis as well as hepatocellular carcinoma in the long run. Besides, glycogen storage disease is also defect in the glycogen metabolism of the liver, because glycogen is one of the important storehouse or storage form present in the liver. An abnormal of the glycogen storage disease may also leads to increased risk of hepatocellular carcinoma. There are certain chemicals like polyvinyl chloride and thorium oxide. So these are also various substances that can also lead to the increased risk of hepatocellular carcinoma. So some substance like polyvinyl chloride, which is present in the plastics, polyvinyl plastics in various water pipes, they are present. So it may be important composition of various type of plastic pipes. So polyvinyl chloride increase the risk of getting angiosarcoma of liver. That is another type of carcinoma of the liver. So polyvinyl chloride is another toxic which increase the risk of development of angiosarcoma of liver. Beside, thorium oxide also increase the risk of cholangiocarcinoma as well as hepatocellular carcinoma. So both the polyvinyl chloride or vinyl chloride and thorium oxide, both are carcinogen or pro-carcinogen. They increase the risk of hepatocellular carcinoma like angiosarcoma of liver as well as cholangiocarcinoma also. Now, last but not the least, there are some drugs. Excessive intake of some drugs or excessive exposure to some drugs like anabolic steroids may ultimately increase the risk of suffering from hepatocellular carcinoma. Anabolic steroids actually patients or subjects are taking to increase the masculinity of the subject for development of the bulk of the muscle, and also sometimes it increase the athletic endurance. So some physical exerciser or bodybuilders take anabolic steroids. Now if anabolic steroids are taken for longer duration or long-term therapy can lead to development of hepatocellular carcinoma. So today we already discussed about the various risk factors of hepatocellular carcinoma, and proper knowledge of hepatocellular carcinoma risk factors can help us in prevention of hepatocellular carcinoma, because most of the patients of the hepatocellular carcinoma are already patient of chronic liver disease. So knowledge of the risk factors is very much important, because if we know the risk factors we can try to prevent the conversion of the cirrhosis to the stage of hepatocellular carcinoma. So proper knowledge of the risk factors is very much important, as it helps in taking preventive measures in prevention of development of hepatocellular carcinoma. Thank you very much.